36 hours.
Thank you very much, colleagues. To the audience at home listening to this broadcast, to our own colleagues in the media, we are again here to brief our country about steps that we are taking, particularly in the economic sector, to combat the spread of the coronavirus as we proceed to level 3. I have ministers here, Minister Mantashe, I have Minister Tulas Nglesi, and Minister Patel, who will be coming, who is also here to speak to what are these measures we are taking to combat the spread of the disease. Of course, in Cape Town, we are joined through Zoom or Skype. You can choose whatever you want to choose by Minister Dilil. Minister Dilil, are you on Skype or Zoom?
On Skype.
Thank you very much.
Skype, Minister.
Thank you very much, Minister. We appreciate that we have many people awaiting this briefing of the economic transformation cluster in our government. Without any further ado, maybe let's start with Cape Town. Let's start with you, Minister Dilil, so that you tell us what is your readiness for level 3 and what can we expect in your toolbox in the fight against coronavirus. Minister Dilil.
Thank you, Minister Mthembu, and good afternoon to the media, South Africans, and my colleagues. The Department of Public Works will provide you with an update on state of readiness with the number of quarantine sites available with the start of the level 3 regulations on the 1st of June. As it's been just over 2 months since the national lockdown started, and in order to contain and curb the spread of COVID-19 virus, as part of government's response to address the pandemic, various departments had various roles and mandates to fulfill to safely navigate our country through the difficult and trying times. In terms of the regulations, the Department of Public Works and Infrastructure's role is to identify and make quarantine sites available, and for the Department of Health to assess and confirms a facility as a quarantine site to meet the health standard. And once a facility has been confirmed as a quarantine site, the Department of Health will then make it operational, and the site will be activated and procured by the Department of Public Works and Infrastructure. So our task, therefore, is to identify quarantine sites in all 44 districts and the 8 metropolitan. We have also engaged with the provincial departments of public works, with the various municipalities in all the 44 districts and metros, to also make available sites for quarantine purposes. As level 3 starts on Monday, the 1st of June, we would like to update on the DPWI's state of readiness with quarantine sites, as the infection rate is expected to increase with millions of people returning to work on Monday. So DPWI has been working on all fronts over the past 2 months to ensure that we are ready for all eventualities and the worst case scenario by having enough quarantine facilities available as the need arises and should the number of people who need to be quarantined increase dramatically. The Department of Public Works and Infrastructure has also approached the private sector, especially the hospitality industry, to make available some of their facilities for quarantine sites, since they didn't have any guests during the lockdown. And I want to thank the private sector for all the offers that they've made to government. We have so far identified 1,751 facilities, representing about 129,600 beds across the country. And of the 1,751 facilities, 642 are state-owned and 1,109 are private-owned. In the Western Cape, for example, which is currently the epicenter of COVID-19 in our country, there are 358 facilities that have been identified, representing 27,500 beds. Some of these facilities have been assessed by the Department of Health and confirmed as compliant. And nationally, 395 facilities have been assessed by the Department of Health, representing more than 35,700 beds. And in addition to state-owned and private facilities, there are also sites from state-owned enterprises, such as Transnet and Eskom facilities. And these sites have been assessed by the Department of Health and activated by the state-owned entity. The public sector sites that have been activated and set up by government, these public sites are being managed and by government and also by the respective provincial government. Now, with these numbers, we can assure South Africans that the Department of Public Works and Infrastructure state of readiness, that we have enough quarantine facilities available as the need arises, an expected increase in infections and also more people being repatriated. So far, we have repatriated just over 10,000 South Africans from all over the world. And all of them, as they arrive in our country, they are put in a mandatory quarantine period for 14 days by the Department of Health. There's also some work underway by the Provincial Public Works Department in relation to field hospitals. In the Eastern Cape, 32 hospitals have been identified for refurbishment. In KwaZulu-Natal, 19 hospitals are being refurbished. In Mpumalanga, 10 sites have been identified for field hospitals. and the province is currently busy with technical assessment. In the Western Cape, the convention center has been completed as a field hospital site, and other sites have been identified and are being considered to be converted into field hospitals. In the Northwest, the teams are focusing on augmenting the capacity of existing hospitals by constructing additional structures. The remaining provinces are still in the process of finalizing their plans for field hospitals. We are committed to continue our task and do all that we can to keep South Africans safe and to do all that we can to curb the spread of the virus. Thank you, Minister Mthembu. That is my submission.
Thank you very much, Minister Delil. We will now continue to have some more inputs on government's readiness. Having concluded with Minister Delil, we are now proceeding to Minister Mantashe, who will come here. Now, I don't see myself on the monitor, which means that I won't see, South Africa won't see Minister Mantashe. We are still seeing Minister Delil on the monitor. Are we okay? Minister Mantashe?
I need to take that.
Should I start?
Just give us a moment. We're trying to see if we can get the link with Minister Delil changed.
Ngwana sakuva ngo. Oh, yeah. Ngwana sakuva ngo. Awufakele. Ngani Oh, yes. Andiva kanifakele. Yasemgodini. Yasemgodini. Kwenze njani? Linda. Until what happens? Oh, but it kubango. But okay.
I'm listening to you. Can you go on?
Okay. Thank you, Minister Mthembu, who is in charge of the session, cabinet colleagues, Minister Delil, Minister Patel, and Minister Ngesi, members of the media, officials from the various departments. President Cyril Ramaphosa announced that South Africa will move to alert level 3 of the nationwide lockdown. This will open up the economy and remove several restrictions while government significantly expands and intensifies public health intervention. Our department, the Department of Mineral Resources and Energy, has been engaged in continuous discussion with stakeholders in mining and energy portfolios to ensure that our collective intervention save lives and protect livelihoods. We're going through a very difficult period. We are called upon to learn to live with COVID-19. We need to grow the economy while at the same time we save lives. In our view, energy will be the flywheel of reviving our economy, which has been severely impacted upon by downgrade to junk status, recession, and COVID-19, because a combination of the three is what impacts on the economy. The measures that we have taken have been developed in line with the call by the President for government to consult and implement a risk-based strategy that will enable a phased recovery of the economy. Let me talk briefly about the energy. To ensure security of energy supply to society, collieries that supply ESCOM continues to operate at full capacity during the lockdown. During alert level 5 of the lockdown, we allowed refineries to continue operating at full capacity to avoid shortage of fuel. At the time, demand had collapsed due to closing of the economy. As a result, 4 refineries were temporarily closed. With the gradual opening of the economy and the rush in preparation for level 3, the demand increased sharply, resulting in low stocks of diesel. It is expected that diesel will be rationed to meet the demand until the end of May, when refineries that were closed will start producing. The department issued directions to provide continuous supply of energy and petroleum products by allowing maintenance and construction work for energy projects to resume under strict health and safety protocols. These directions apply to professional entities that provide licenses, approvals, and authorizations for the maintenance and construction of energy projects. All professional planning, costing, and design work that supports construction work on sites, contractors and consultants who need to travel across borders to attend to projects and energy construction work already priced and awarded government tenders are allowed to travel. To give effect to SONA 2020 commitments and ensure security of energy supply, we have implemented all the resolutions that were announced. I can expand on them when there are questions. In mining, under level 5, collieries that supply ESCOM and oil refineries were allowed to operate at full capacity. This was extended to open cast mines under alert level 4. Under alert level 3, all deep mine operations are expected to ramp up to full capacity. This brings mining to full capacity of production. All mining operations must prioritize health and safety of mine workers and other persons who may be directly affected by the operation of the mines. Compliance with conditions to the starting and increasing of capacity as enshrined in the lockdown regulation is compulsory. Prior to ramping up, all mining operations are required to prepare and implement mandatory code of practice for the mitigation of management of COVID-19. Failure to do so will be regarded as criminal offense and a breach of Mining Health and Safety Act. We believe that the directive to all mining operations to ensure safe startup procedures and the systematic phasing in of workers will allow the sector to operate safely. The department continues to monitor compliance through regular, unannounced, and scheduled visits to the mining operation. Following unannounced visits, we discovered that not all operations are at the same level of compliance. Most of them were doing well up to the screening, but lagging on testing. Once we made that discovery, we gave the feedback to the Mineral Council South Africa and insisting on improving on testing. Our insistence on testing and screening of all persons on the mine has enabled us to detect the virus in various mining areas. As of Thursday, 28 May 2020, the mining industry had tested over 4,600 persons at mines, of which 384 tested COVID-19 positive. Let me repeat the number. 384 as of yesterday tested COVID-19 positive. This means that of the 27,433 cases in South Africa, 384 are in mining. The more we test, the more we become aware of the extent of the problem and the location thereof. The new complication that is emerging is people who show no signs of COVID-19 but testing positive. This tells us that we need to intensify our screening and testing program. We urge all mining operations to pool their resources together and share testing and quarantine facilities. Wherein there is non-compliance to the regulation and a threat to the health and safety of any person at mines, the department will not hesitate to issue instructions as guided by mine health and safety, including closing an operation. We want to express our appreciation for the support we're getting from MECs of health in all the province up to now. We wish to express our condolences to families of those who succumbed to COVID-19. We wish those who have tested positive a speedy recovery. Thank you very much.
Thank you, Minister Mantashe. We will now give an opportunity to the Minister of Labour and Employment, Minister Ngesi, to speak to the nation. Minister.
Thanks to Minister Mtembo and the colleagues who are with us from the cabinet and the departmental officials and the members of the media. As Minister of Minerals and Energy has indicated that the President has announced our moving to level 3 of the lockdown from the 1st of June. This means that a lot more people will be going back to work. And in the face of the pandemic, there are important actions that need to be taken to make sure that we reduce exposure to COVID-19 in the workplace. We have therefore, in consultation with all the social partners at NETLEC, drafted amendments to the directions or directives issued on the 29th April 2020 when we moved to level 4. In terms of the draft amendments, employers who will be reopening their businesses in terms of alert level 3 will be required to do the following: appoint COVID-19 compliance officers, undertake a risk assessment of the workplace, and develop a plan for the return to work. This must be done before the reopening their businesses in consultation with the representative trade unions and health and safety committees. key draft changes which we have made, the obligations of the employers to employees who have comorbidities or are over 60 years of age have been clarified because of the medical evidence that they are more vulnerable to COVID-19 complications or death. Workers who have had close contact involving a high risk of transmission with a worker or workers diagnosed with COVID-19 must be placed on 14 days quarantine with paid sick leave. And I want to emphasize with paid sick leave. Department of Health guidelines set out the procedure for assessing the risk of transmission. The requirements that all persons must wear masks in the workplace and that each employee must be given free of charge at least 2 masks are retained. The requirement to wash masks at work has been removed after the feedback from the trade unions. The draft direction clarifies that employees have the right to refuse to work if they have a reasonable belief that the necessary precautions have not been put in place to prevent the transmission of COVID-19. Where such disputes, and we hope it's not going to happen because everybody is sensitive to this, where such disputes arise, employers should seek to resolve these as quickly as possible. If the dispute leads to the dismissal or other unfair labor practice, these cases may be referred to the CCMA, the Council for Conciliation, Mediation and Arbitration. We have activated them starting from the beginning of the week. The direction also clarifies that employers may not deduct the cost of COVID precautions from the employer's wages or employees' wages or require them to pay for these. These draft amendments to existing directive will be finalized and published upon approval, and we are doing that today or tomorrow. We cannot overemphasize the importance of ensuring that employers, both public and private, mitigate the worst effects of the pandemic. Both public and private, we want to emphasize. As the Department of Employment and Labor, one of the most important functions that we have to perform is to inspect workplaces to ensure healthy and safe working conditions. Unfortunately, the Inspection and Enforcement Services branch has seen low compliance, which, given the issues of the pandemic, means that employers have to do more to ensure their workplaces are safe. Workplaces need to ensure that the correct number of employees return, that office space and factory floors are in a desirable state, and that cleanliness and hygiene are top of the mind with the workplaces having been deep cleaned and vehicles disinfected. As indicated, the state of compliance leaves much to be desired. For example, in the inspections conducted on Monday this week of the 72 workplaces, 44 of them were not compliant. As a result, the inspectors served 6 prohibition notices, 37 contraventions, and 6 improvement notices just on the one day. We need to change the behavior in response to the dangers posed by the COVID-19. This message has not embedded itself in the consciousness of many employers, according to what we see in our statistics. The cumulative picture from the 30th March to 30th May is not positive. In that period, a total of 332 prohibition notices were served, which averages out of 9 prohibition notices per day. Out of the total amount of 3,844 inspections, 2,116 complied, whilst 1,724 failed to comply. This situation is now further complicated by the fact that at level 3 of the lockdown, many more manual workers will be returning to work. often working for smaller, less resourced employers. It is therefore critical that all the parties are alert and redouble efforts to safeguard the workplace against the spread of the virus. We would expect every employer to jump at the opportunity of saving their company by protecting their key asset. And that key asset is their workers. Inspections have been and will continue to be conducted in the public and private sectors, and it pains to announce that as we send our inspectors out to the workplaces, they are also affected. As we speak, a number of our inspectors here in Gauteng are in self-isolation following one of their colleagues testing positive. We also have, or we have had one fatality of one of our workers who passed on as a result of COVID-19. Again, the lesson is clear. None of us is immune from the virus, and every effort must be made to ensure the health and the safety of all workplaces. Just briefly on the income support, the UIF. Since the start of the lockdown, the UIF has committed over 17 billion and paid out over 15 billion in COVID-19 benefits to 3 million workers through the 200,000 employers and the bargaining councils. These disbursements have been in lieu of salaries that could not be paid, or as a top-up where salaries have been reduced. Each of the 3 million recipients have families and dependents, greatly increasing the reach of the COVID benefit scheme. We will continue to process the April application as well as resolve the outstanding queries. Yesterday, we opened the May applications, which we are currently processing. My apologies for the 2 days delay caused by, of course, the break in the in the fiber cable. This situation has now been resolved. We believe that the move to alert level 3, the financial burden of the UIF will be eased somewhat as more and more people go back to work. So the fund's primary responsibility to pay ordinary UIF benefits to contributors has not been interrupted during the lockdown, with some 2 billion dispersed to 280,000 claimants. We anticipate that ordinary claimants will increase as unemployment increases in the wake of the pandemic. The UIF is preparing for this eventuality. We are also committed to contribute to economic recovery and job preservation as required by Section 5 of the Unemployment Insurance Act. The labor activation programs will remain a critical part of the mandate of the fund, along with other job creation programs. Looking to the future, serious discussions will be held at NETLEC on the finalization of the comprehensive social security and retirement reform framework, a holistic approach to the provision of the social security safety net into the future. On the compensation fund, it will be expected to deal with the compensation for COVID-19 contracted on work duty. Already we have received 116 claims and we have already accepted liability of 108. The majority of the claimants are females who represent 91% of the claims. The big numbers are from KZN with 63 cases, 54%, followed by the Western Cape with 32 cases, that's 28%, and Gauteng with 18%, with the majority claims. 83% of the claims are coming from the healthcare practitioners. The CCMA, which is the Council for Conciliation, Mediation and Arbitration, reopened for physical referrals last week, and we all witnessed the large numbers of people who came to our offices. Physical hearings started on Monday, the 18th May 2020, and the offices opened for physical referrals. The walk-ins on Wednesday, 20th May, resulting in increased volumes of referrals. For the month of April, there were 1,682 referrals mostly dealing with retrenchments or retrenchment applications and dismissals. Between April 1 and 27, the CCMA has received cases which in total affect 28,000 employees. So in attempt to reduce the spread of the COVID-19 virus and the need for applicants to have to physically go to the CCMA offices to obtain referral forms, from the 8th of June 2020, the applications and the referral forms will be available electronically from the CCMA website and the CCMA Connect app. While on the normal terms, with regard to the normal temporary employees relief scheme applications to support the wages of the employees in distressed companies, the CCMA has received 47 applications, which are currently being processed. And Productivity South Africa, to turn things around, the department through the Productivity South Africa focus on enhancing the operational efficiency of the companies facing the COVID distress, to preserve jobs and to mitigate the retrenchment of workers. This will include implementing the turnaround strategies to restructure and improve the competitiveness. So our interventions will focus mainly on the small businesses. On the 1st of June, we intended to open our offices, but it's clear now that on the 8th, the labor centers will open primarily to assist the clients with queries and applications to the normal UIF, because we have to do a lot of training so that we don't spread. As much as the workers will come tomorrow to open the offices, but we'll start the proper work on the 8th because we have to do that training. I just want to close by saying the department encourages the use of their online services for clients to be serviced remotely to avoid overcrowding as well as the spread of COVID-19. And clients should please note a register must be maintained to capture the detail of all clients entering the buildings, their contact numbers and physical addresses. And during this COVID-19 period, it's critical to have these details in order to conduct contact tracing should the need arise. And our client services centers, of course, will be reconfigured to ensure social distances, and all clients must wear these masks as they enter the premises to be served. Queuing, as usual, will be should adhere to 1.5 meters social distance protocol, which will be clearly marked. And all points of the entry in the building will have hand sanitizers, disposable towels, waste bins, and digital contact thermometers. Thank you.
Thank you, Minister Ngesi. Minister Patel, I know that you wanted to do many things, but let's do what is possible now. What we can also do is to at least allow one of the commissioners to come here as well to assist you with explanations of some of the issues. But I know that we needed to get a linkage as well. Now that proves to be very difficult. But the opportunity is now yours, Minister Patel, Trade and Industry.
Thank you very much, Minister Mthembu, colleagues, members of the media, fellow South Africans. Yesterday, in the presentation on the regulations, we noted that level 3 will see a very significant opening of the economy. Most parts of the economy will open up completely. Some workers will still be working from home, those who are over 60, those with comorbidities. But in addition to that, there'll be a few smaller areas that are not yet open that we will be working to see how we can safely open. So what this has done, it's put the spotlight on what we can do to reduce the speed with which the virus spreads, to contain the spread, to ensure that we flatten that curve. And so today I want to just introduce a few people who are in the audience. They will be sitting there, and members of the media will have access to them, because they are South Africans who are doing exceptional things to make the country ready to deal with this increased numbers of people who will be at the workplace. If we are to successfully bring more than 8 million additional workers over the next period back to work, in some cases, you will see factories beginning to resume full production from next week. We will need a toolbox. Every industry, every workplace must have a toolbox. That toolbox would be measures to ensure social distancing. And we announced yesterday a number of social compacts have been agreed with employers and businesses, with trade unions, to ensure that there is cooperation in limiting opportunities for a rapid spread of the virus, because we have to contain it. Today I want to just briefly talk about other elements of the toolbox, other things that we will do. We will need more face masks, because face masks are critical for healthcare workers over the period as the economy opens, as the level of infection rises. More people will need attention at hospitals, and that puts more pressure on hospital staff. So each of the hospital staff will have to wear some of the most advanced face masks. Some of these face masks are called surgical masks, others are called N95 standard masks, some are called FFP2 or FFP3 masks. And I think the important story today that I want to tell is how we've been able to use more local manufacturing to make these advanced masks. At the start of the pandemic, when the first numbers of people were infected in South Africa, we had a very limited capacity to make these advanced masks. Let's call them the medical masks. And over the last number of months, entrepreneurs and government agencies and others have been working to ramp up production. I have in the audience today, for example, some people from factories that are producing it. In May, this month of May that we're just about to leave now, we were able to produce something like 25 million of these surgical and medical masks. By June, in other words, in a few days' time, the production will ramp up. By the end of June, we would have been able to produce some 31 million masks. So what that is, it means 1 million masks, surgical masks and medical masks, every single day, Mondays to Sundays, that is running off the production line. David Molosanke and Jodine Eckstein are here today. They are co-owners from a factory called UMask, which is here in Pretoria. And they produce masks for healthcare workers. And some of the masks that they have will be shown later to members of the media. I have one sample here of this company. We also have a company called Green Line. We're producing the FFP3. You see it with this little gadget attached to it. And that's one set of masks that are produced. So this special type of masks, already 1 million of these masks are coming off production lines now in June. Some companies have produced face shields. A face shield is like this. Previously, Minister Mantashe was here and he was wearing his face shield. And one of the big producers of this face shields has actually been a car plant, the Ford Motor Company. And they made an offer to government. They'll get their workers back to work and they'll produce this free of charge for the public sector. But there are many other companies that are also producing these face shields, and you members of the media and South Africans would have seen it in supermarkets and elsewhere. But But in addition to these masks, which are important, we also need other materials and protection equipment. They range from medical scrubs and disposable overalls that you see surgeons and doctors and nurses wearing, isolation gowns, and so on. And I have here Boipelo Mononyani, who is the Chief Operations Officer of a factory that her mother is the owner of. It's a company called GBSA, and they make these kind of gowns and other products. Her mom has been in the clothing industry for some 24 years, and they employ 50 workers now. And they're working to ensure that healthcare workers have these protective gear available. In addition to making things local, we've also asked our agencies like the IDC and others to help ensure that while we're ramping up production, we also get more of these face masks imported. The imports are a temporary measure while we ramp up production. And at home, many South Africans are making face masks. People are sewing them in townships, township seamstresses, and large and small factories are making these masks. We're manufacturing hand sanitizer. We've got Sasol, one of the large South African companies, to take its entire production of ethanol and make it only available for the production of hand sanitizer. Some of the large alcohol manufacturers have also produced industrial alcohol that goes into the production of hand sanitizer. I want to talk next about what happens if the virus, in spite of hand sanitation and masks, or perhaps in instances where these are not fully adhered to, when the virus enters the body. It means that people will need to get some attention. Many South Africans, as Dr. Zweli Mkhize has said, will have mild symptoms, but there are those who are going to have challenges and they may need to be rushed to a hospital. And so more field hospitals are being built. But the area that we're looking at in manufacturing is to produce more ventilators. Ventilators are really a way of getting oxygen to the lungs at the time when someone is affected by coronavirus and they have difficulty breathing. And the ventilators range from what is called ambu-bags to nasal cannula, to something called the CPAP. Many of us would have seen it on television. It's the thing that they put over your face and the oxygen is pumped into the body. And finally, there are these very invasive ventilators that are used in critical care where nothing else works. In April this in this year rather, we had launched a project, the National Ventilator Project. And it was done to try to build more South African ventilators. Before April, we had tried hard during March to get ventilators from the rest of the world, but everybody was chasing the same product. So wherever factories were making these things elsewhere, the orders were immediately snapped up, and we couldn't get enough ventilators into South Africa. We last produced ventilators more than 2 decades ago, and when the pandemic hit us, we had no local manufacturing capability. But South Africans are resourceful people. And so we made a public call and said to industry and to innovators, come up with plans and ideas. And they came up with many ideas. We created the National Ventilator Project. We asked the people, some of our leading scientists, to sit on a little panel to evaluate these. And I had wanted to just show one prototype as an example of what is now being developed here in South Africa. It's a prototype of a ventilator. It's made by a local company, and we're now working to get 3 of these, 3 prototypes finalized. And after we've finalized these 3 prototypes, production will start now in June. And the first units, we hope, will come off the production line during June. July, we're scaling up quite significantly. And by August, we would be able to reach the target initially of some 20,000 ventilators. And this would be critical additional stock. Once the first production starts, it will go through a fast-track regulatory approval process, because these are medical devices and we need to make sure that they work well. But we're putting a lot of effort into this while we're also trying to find ventilators from the rest of the world. So it's trying both tracks so that we can ensure that, to the best of the ability of South African industry, we're able to support the fight against COVID and provide our people with the necessary support. In addition to that, the National Empowerment Fund has also started, it's put aside 80 million rand for businesses. It's called the COVID-19 Black Business Fund. And they've been overwhelmed by applications. More than 300 applications have been received, well more than the amount of money that is set aside. And they're now looking at ensuring that these are made available as quickly as possible. They also have granted repayment holidays to about half of the businesses that they support. Finally, there's been a request from the public that we must do something about the rise in prices. And I must say that we've made public some of the actions that the competition and the consumer authorities have been undertaking. We are joined today by the Commissioner of the Competition Commission, Commissioner Thembinkosi Bonakele, and he and his team has investigated a large number of complaints that we've received from the public, where prices have suddenly risen. And as we indicated yesterday, some price rises may be unavoidable because we import the products, and as the rand value drops, the cost of these products increase. But in a number of cases, the Commission has found that individual players, maybe it's a pharmacy, maybe it's a shop, seem to have increased their prices simply to make a profit out of the hardship that South Africans are going through at the moment. Our laws don't allow excessive prices by dominant players. They don't allow for unjustified exploitation of a market. And early in the pandemic, we had published some of the directions to deal with this. I'm going to ask Minister, I want to check with my colleague if this is now a good point, Minister Mthembu, that I would like to invite Commissioner Bonakele to share the work of the Competition Commission, to briefly provide some details to South Africans. And there are a number of other people in the audience. We won't call them up today for logistical reasons, but they would be available if needs be to speak to members of the media. I see you're nodding in concurrence, colleague, and I'm going to then invite Commissioner Bonakele to come up and briefly provide some details of the work, the excellent work that the Competition Commission is doing.
Minister Mthembu, ministers, officials from various departments, members of the media, fellow South Africans. The minister has already summarized a lot of the work that the Commission covers. I just want to set out a few details on some of the work already done. Some of you will recall that just before the lockdown, the Commission completed its work against mobile operators with findings of excessive pricing, especially pricing that was anti-poor. We settled the case with both Vodacom and MTN with a set of commitments. The first set related to consumer prices, which had to be dropped by 30 to 50%. But the commitments also included 0 rating, or in layman's terms, free access into certain websites. These websites included educational websites, in particular covering the syllabus of all public schools. I mention this because, coincidentally, it happened just before the lockdown. And little did we know then how important this intervention was going to be in times like this. Of course, the challenge now is to make sure that we monitor compliance with those commitments, which are an order of the tribunal equivalent to a court order. So we expect that school syllabus and homeschooling will now be enabled by free access to these sites by the largest mobile operators. In fact, all the mobile operators, even those who were outside this agreement, have subsequently signed up into that. So we expect that access to be free. Of course, the challenge of connectivity is still going to be there, because we know that there are areas where we still struggle to get schools connected and certain areas connected into the internet. This is an ongoing struggle. But nevertheless, I think we have made significant strides. The second area of our work I just want to touch on very briefly is that of exemptions. There is a possibility in terms of the Competition Act for industry to be exempted from certain provisions of the Competition Act. And many industries have applied to the minister for these exemptions. And we encourage, especially the small ones, to do so. We are not just carrying the stick. We are also sensitive that in times like this, there are sectors that do need to cooperate. We have had the minister granting, for example, exemptions in the healthcare services, because we know that the public sector is going to have to procure various healthcare equipment and even hospital rooms, including ICU rooms from the private sector. So all of that is being facilitated by the work that we do in support of the minister. The third category is that of mergers. We know that many firms are distressed during times like this, and part of the reorganization is going to include mergers and acquisitions. We have to look very carefully into these, because they tend to have a significant impact on employment. And so we already have a list of these reorganizations that are taking place. And with time, we will report on the outcomes. The last area I want to touch upon is what the minister has already mentioned, which is the work we do in enforcing the Competition Act, compliance with provisions of the Competition Act. And one key provision relevant at this time is that of excessive pricing, or what we call price gouging. To support this work, we are monitoring prices of certain essential items. These include items that are needed for COVID-19, but also essential items such as food, basic food products, and so on. So partly we have to do a monitoring, which includes research and just checking what's going on. And Stats SA is also doing a lot of work, is releasing statistics every 2 weeks. So we are able to see. I think this is a very important assurance to give. And what we've seen in the past couple of weeks is that prices, although initially spiked as a result of panic buying, but also opportunistic behavior by many traders and retailers, prices have somewhat stabilized. this is what the data is showing us. There is still opportunistic behavior, especially in things related to masks and so on. But when it comes to food, we've seen a lot of stabilization there. We are not out of the woods yet. There are food items. Minister has already mentioned that we import. So we expect that we are going to have price hikes. For example, many rice-producing countries are no longer exporting rice, so it is going to, prices will increase at some point. We also import a lot of wheat. We know that we are going to face some price hikes there. This is the crucial point. Even where you have price increases, you need a watchdog to check whether the extent of the price increase is justified by the cost that the supplier is facing. So this is also an assurance that we want to give, that we have our experts on the ground, our economists, following what the cost increases are and whether whatever price increases we face are justified by such costs. There are, in this respect, suppliers that we have taken to the tribunal for prosecution because we have not been satisfied that their price increases can be justified by costs and related matters. Ever since the lockdown started, we've had more than 1,500 cases. This is just the Competition Commission. Of course, our counterparts in the National Consumer Commission also have their numbers. Out of these cases, we've already prosecuted and leveled fines of about 13 million. Of course, some of these have now been redirected as donations to the Solidarity Fund. We also have outstanding cases where we are awaiting judgments. Some of you may have seen in the public domain, for example, that a large supplier of masks, Discam, has been under prosecution at the tribunal. That case is complete. We are done with it. We are waiting for a judgment. And there are many others. We have over 30 firms that are at various stages of concluding settlements agreement with an admission that they increased prices unfairly. So that, all of that is work in progress. But in concluding, ministers, I wish to say that without declaring victory on prices, that I think the work that was done earlier on by either government and regulatory authorities, making calls and warning suppliers about the laws and making the right regulations have yielded some positive results, in the sense that although we have a few who are still engaged in opportunistic behavior, but by and large, I think prices are under control. Of course, doesn't mean that we must not be careful. We must continue monitoring them very, very closely. Thank you very much, Minister Mthembu, for the time. Thank you, Minister.
Thank you very much.
Thank you very much, colleagues. We have now reached the stage where we will take questions directed to my colleagues on the inputs that they have made from this podium. Without any further ado, is there any person on the online services?
Thank you, Minister. We don't have callers at the moment.
Thank you. Nangaba, do you have any people asking questions from your WhatsApp services?
Yes, Minister, we do.
As usual. Okay. Okay, let's start, Nangaba.
The first question is from John Fraser from ZA Confidential. It's directed to Minister Patel. Does Minister Patel envisage South Africa becoming an exporter of PPE in time? The next question is directed to Minister Mandashe from Jan Cronje from Fin24. And the question is, Minister, who is responsible for procuring COVID-19 tests that mines use? And with the backlog of thousands of tests, how long are mines waiting to receive the results for their testing?
Minister Delil, can you hear Nongaba there?
I can hear.
Not me, the questions.
Yes, I can hear the questions, Minister. Thank you.
Thank you very much, Minister. Thank you very much. Can you continue, Nanga?
A related question from Alan from Business Day, also directed to Minister Mandashe. With a backlog of nearly 100,000 unprocessed COVID-19 tests, how do you suggest the mining industry increase testing, and how does a collaborative approach you suggested help? And is there a percentage of infection where the department will order the shutdown of mines, and what is the shutdown trigger? Then the last question that we have so far is from Vikas Berger from Nagwerk Virendwendach. It's directed to Minister Patel. Can you please clarify and provide detail on regulations under level 3 regarding domestic workers, including gardeners? Also, should domestic workers, including gardeners...
Can we direct that question to the right minister?
Okay.
Okay. Okay, continue.
Okay. Should domestic workers, including gardeners, be transported privately by their employers, or can they, domestic workers or gardeners, also make use of public transport to travel to their workplaces? What safety measures should be put in place by the employer? I assume the question was actually directed to the Minister of Labour.
It will be.
Yes.
The other part that talks to transport, the Minister of Transport is coming tomorrow. But having said that, can we start with Minister Mantashe?
Oh.
You use that one? The one that you have in front of you? Yes, there we are.
Oh, this one is 7.
Yes.
Okay. Who procures test kits for the mines? It is the mining companies. They procure the test kits. Actually, when we did our unpronounced visits to the mines, we discovered that many of the mines were complaining of incapacity or shortage of test kits. We advised them to pool their resources together and establish regional centers for testing. That's why if you go to Carltonville, you're going to see the old Leslie William Hospital, which is now a private hospital, being used by all the mines in the area. If you go to Rustenburg, you'll see 2 hospitals used by all the mines. So it goes on and on in all the regions. The pooling of resources make it less expensive on the individual mines. So who procures test kits is the mines through the centers that they fund. Unprocessed tests, there's a backlog of unprocessed tests in the mines, because you remember that when we insisted on bringing mine workers to the mines where they can be tested, there was a lot of resistance to that. But we insisted that, listen, if mine workers don't come back, you're not going to test them. And the problem is that when they come back in big numbers, you're going to have a spiral in every mining area. Now, the systematic phase-in of bringing back mine workers gave us capacity to test them. That's why we're not shocked by the result of testing. Now, what is the trigger for shutdown of a mine? There are many triggers. Let me give you an example. We went to a mine in Tubasi Valley called Dwasrefir. When we came there, we found one case that tested positive, and we visited that mine physically. We discovered that there were no screening and testing. We used Section 54 and closed that operation and said, you will test, you will screen. And that's where we discovered 31 cases in one set of tests. We had closed that operation, it's not open yet. The second one is an example of Mponeng in Carltonville. On the basis of the numbers, the company agreed with us that, listen, we're voluntarily closing this operation until we know the extent of the problem. So there will be many triggers that lead to a closure of a mine. But the reality of the matter is that we don't want mines to fear closure and therefore avoid testing and hide cases. We want mines to test and appreciate that we're going to work together in confronting a challenge that is facing the mining industry. It is not the primary intention to close operation. The primary objective is to detect the extent of infections in the mine so that we know what size of a problem are we dealing with. Because when we know, we're better off than when we do not know. Thank you.
Thank you very much, Minister. Minister, I say you can use that one.
Oh, no, yes.
Do you hear me?
Yes.
Thank you. No, the issue of transport for the workers was meant for the large employers, and also in particular, one example is mining. And because some of them will have to adapt the workplaces, they have to introduce the shifts and so on. And some of the people might knock off very, very late when e-transport is no more available. So we were talking about those. But when we're referring to the gardeners and the domestic workers, we expect that they will be using public transport. But that's why there are certain protocols which are expected from the public transport as issued out by Minister Mbalula, including the issue of social distancing and so on. Thank you.
Thank you, Minister. Minister Patel.
Thank you very much. I think the only question was from John Fraser on the export of PPE to the rest of the continent. John, in fact, you've pointed to a significant opportunity, and we've already begun to supply and export PPE to neighboring countries and to the rest of the continent. With a global shortage of personal protective equipment, many countries on the continent look to South Africa to assist in making kit available to fight the virus. And it's important that we do so because as neighbors, it's only when we can ensure that the infection does not spread across the region that South Africans are safe. But there's also, of course, social solidarity that we need to show to neighboring countries. And very importantly, in the long run, there are economic opportunities also. The lesson of the pandemic is that Africa as a continent must make sure that we have the required capabilities and capacity to produce, that we must never again be subject to the shortages we've seen globally that places the lives of our people at risk. So in this period, on hand sanitizer, which of course is a critical first-line defense, we have now exported 150 million liters of sanitizer to countries elsewhere in the continent. Most of it is to immediate neighbors, but some of our sanitizer, hand sanitizer, has also gone to Ghana, to Kenya, to Nigeria, and to Uganda. On face masks, millions of face masks have now been produced and made available for healthcare workers in neighboring countries and elsewhere. Their governments have placed orders with South African factories, and these have been produced. The biggest one has been the sale of masks to Botswana, followed by Namibia and, of course, Zambia, Lesotho, and Eswatini. I want to indicate, though, that with masks, we've also been able to export masks to countries like Nigeria and Egypt and Algeria, Gabon and Kenya. These are all examples of South African manufacturers already taking on the responsibility to produce so that we as a continent, as Africans, can ensure that we have the necessary tools that's available. Besides the PPE area, I should say, John, there's another issue, which is medication, general medication. Of course, much of during the time when people are affected by COVID, they'll need a range of general medication. But also, in addition to that, even those who are not infected still have medical needs. People are diabetic, they've got asthma, they have cancer. And South Africa has been a significant producer of general medication, antibiotics, antivirals and pain medication. And we've sold about, out of everything we've exported, about 3/4 of it has been to SADC countries. It's the Southern African Development Community, so that's our immediate neighbors. And much of the rest has been sold on the rest of the African continent. So it underlines what you've indicated. It shows that it's not only a future opportunity, but it's also currently something that we are doing. And we've encouraged manufacturers to ramp up and to think of the whole African market. We will soon be implementing the African Continental Free Trade Area. It was due to start, of course, on the 1st of July, but because of COVID, it will be postponed, and a formal date will be announced as soon as we have agreement by all countries that are affected by the free trade agreement. And that's the moment when companies, manufacturers, will be producing for a wider market. Thank you.
Having said that, now I don't want to be arrested by Minister Bheki. Can you shift to this side? Because I need to adhere to social distancing. So, much better. Thank you, colleagues. Do we have anything on the online services?
Thank you, Minister. We have one caller on the line, Thabo Makutwane from Rainbow FM. Over to you, Thabo.
Thank you, ministers. Good afternoon. My first question goes to Minister Nxesi. Minister, you mentioned notices. You mentioned something about notices issued to non-compliant businesses. From prohibition to improvement notices, could you please explain what exactly do these notices mean? And my second question is to Minister Patel. You made mention of the word toolbox. I know at level 4 we were already seeing closures in the retail and healthcare sectors due to infections. So this means the country should somehow expect a rise in infections as we move to level 3. So I just wanted to know what measures have you put in place to deal with the spike, or are we going to see a recant, particularly for certain industries, if we see a spike in infections? Thank you.
Thank you very much.
Sorry, Minister. We also have another caller, Vuyo Mvogo from ENCA.
Vuyo, the usual suspect.
To the Minister of Labour and Employment, I just wanted to check if there will be any special dispensation for schools, because they may not be able to appoint compliance officers and the like. I mean, a school typically has teachers, pupils, a small number of people that may include a secretary, a gardener, or a caretaker. So, and this is where there's probably going to be a high need. What is going to happen there? Is there a special dispensation for schools? And then another question to you as well, Minister, is whether companies that say applied to the UIF in April and they were successful, but they still haven't received the money but had to pay or have to pay, the workers end of this month on the understanding that they were going to get the money. Will they still get the May money, or will you start, let's say, in June? If you can just clarify. And just lastly, to Minister Mandashe, just your assessment of what could be responsible for the spike in positive cases in the mining industry. Thanks.
Thank you for your...
The last caller, Minister Bonga Dulani from EWL. Over to you, Bonga.
Another usual suspect.
Hello, Minister. Thank you. Minister Ngesi, when you say that employees have the right not to work if employers don't employ safety measures when dealing with COVID, going back to work next week, what kind of sanctions do you look at also if maybe you have usual suspects when it comes to not following safety protocols at workplaces? Can you recommend, or are you looking at the government? Thank you.
Can you repeat that? What kind of what, Bonga?
What kind of sanctions is the department looking at usual suspects? Yeah.
Thank you very much.
Thanks.
Can we take, we have taken 3, let's take maybe another 3 from your side.
Okay. Another question from Jan Cronje from Fin24. It's related to Bonga's question. It's to the Minister Ngesi. If an employee has reasonable belief that their employer has not put in place required precautions against the spread of COVID-19, what specific steps can that employee take? The next question is from Carol Payton from Business Day. It's also for Minister Ngesi. Can you elaborate on the regulation that colleagues in close contact with infected individuals must be quarantined for 14 days? How do you determine what close contact is? And secondly, does this restriction apply to health workers? And on the requirement to close workplaces where infections have occurred, what exactly are the regulations, and do these also apply to health facilities? And then the third one is from Kyle Cohen from News 24. It's directed to Minister Patel. Could you please provide an update on the National Ventilator Project? Has a final design been decided? And what progress has been made in terms of starting production? When will the National Ventilator Project start production? And how many ventilators are expected to be completed on what timeline? Then we have a related question on ventilators from Amanda Watson from The Citizen. Will there be a special dispensation from National Treasury for the Department of Health in terms of tenders or other red tape where ventilators are concerned? Thank you.
Do you have a question, Minister Mantashe?
What?
Take it.
Should I take it?
Yes.
There is only one question as to what is responsible for the spike in the mining industry. There are 2 reasons for that. The first one is that during the lockdown, there was no testing happening in the mines. Now there's testing. That is one reason for that. And when we said allow mine workers to return so that they can be tested, we predicted the spike. And the second one is that because screening and testing is done before people go to work, we're having a better chance to detect the extent of the problem before people go to work. Because once there is an accident of one person escaping and go underground and test positive, the likelihood is that that entire crew is likely to be infected and will be forced to quarantine the entire crew. If they went down with the cage, everybody who was in that cage is a contact. That person will have to be traced and be tested. And every time we do that, there will be a spike in that particular mine. And that is an important development, that mine workers must be tested. The extent of the problem must not be hidden so that we can confront it.
Thank you, Minister. Minister Ngesi.
Let me just first add on the question about the gardeners and domestic workers and say that every employer has a responsibility to provide protective clothing. Every employer, including the employers of the domestic workers. So, which therefore says the issue of the sanitizers, all that protective equipment which might be needed, the masks, it's a must even for the domestic workers and gardeners. Let me leave there. A number of questions which have been asked. Vuyo, any special dispensation for schools? Because schools are dealing with children, I know there are discussions between the education department and the public works about some extra staff members who have to be put in there in order to give support in relation to issues of screening and so on. There are protocols which have been debated or put by or proposed by the Ministry of Education. So that's what has happened there. So there will be people who will be helping in the schools. They cannot be exonerated. All of us, we have to put various protocols. But I think the Ministry of Education can be able to explain that what are those protocols, and that discussion with Public Works to make available some of the EPWP workers to help in the schools. And the other question from, I think it's Jan Cronier from Fin24, if an employee has a reasonable belief their employer has not put in place required precautions against the spread of the virus, what specific steps do you expect the employee to take? We are going to rely, one, on the organized workers, the unions, the shop stewards are very, very important here to be able to help us, because we can't be in every workplace. Even if we had wanted to, we can't be there. Secondly, we've requested that there must be health and safety committees which are put in place in each and every workplace to be able to deal with whatever is emerging or any problems which are emerging, so that they can be able to resolve those. And those health and safety committees must have worker representatives. That's what we are saying. There is no worker who just agree that just go and kill yourself, because that's what it means. If people are forcing the workers to do that, it means if they are not doing that, workers can immediately declare disputes, and they can report to us that here are the people who are violating, and we will be able to deal with those disputes through our structures and so on. But if it becomes better if they have the organized formations at the workplace. I think there's a question from Carol to elaborate on the regulation that colleagues in close contact with the infected individuals must be quarantined for 14 days. How do you determine what close contact is? Does this restriction apply to the health workers? And yes, it applies to all the workers. It applies to all the workers. And how do you describe close contact? I'm not sure how medical people describe it, but what we know is that if there is one person who has been infected, he will have to check all the workers who have been working with that particular person in that particular workplace. That's what we know, or in that particular unit. So that's how we interpret it. And also on the requirement to close the workplaces where infections have occurred, what exactly are the regulations, and do they apply to health facilities? I've said they apply to all. they apply to all. We had a situation in the Eastern Cape where a hospital, Frere Hospital, was given a prohibition notice to say they must close because they had not done 1, 2, 3. The different sanctions which we give the different sanctions. A prohibition is when there's total neglect, and you can see that the workers are in danger. We have not put any of what we have recommended must be put. And remember, this is not just about even COVID-19. Some of these recommendations we're putting are coming from Occupational Health and Safety Act. They have long been there. So we give those prohibition notices if people do not comply 100%, or even we say more than 50% they have not complied. But some of them, we're able to give notices. We say we're giving you 7 days that you quickly deal with these issues, and we are going to come back. And some of them you might find that they've not been able to do 1 or 2 things out of 10 things which they are supposed to do. We are also warning them to quickly deal with those issues. We give them a day or 2. What else? Yeah, I might be leaving something else. I will come back to it but those are the issues which I've been able to capture. Maybe let me also deal with this issue of the hospitals. There's a big debate about the public hospitals in particular. If the regulations are not followed, the protective measures have not been followed, are you able to quickly close the hospital like that? And juxtapose that to the public interest. The hospital might be having 1,000 what we call patients. Are you able to close that? Where do you take those patients to? So clearly the weight of the public interest tends to behavior. Hence we have to quickly intervene and say, try and deal with these issues overnight, so that we don't sit with the issue of saying we are evacuating the patients and so on. But everybody is expected to comply, even if it means people have to work overnight to be able to put those things. But some of the things are simple issues of having people testing or screening the people when they get in, of putting the sanitizers and so on. Those are easy things to do. It's not about major constructions which you have to do. And we urge the public employers also to comply.
Thank you. Maybe also Minister Dilil, you can come in with regard to your role. I saw that in your statement you did mention your role assisting the Department of Education as it relates to screening in schools. Would you like to say a word or two, Minister?
Yes, thank you, Minister Mthembu. I can confirm that we are in discussion with the Department of Education to recruit at least between 4 and 5 people per school that can help with the cleaning, and security. We're looking at a total of 150,000 EPWP workers for a period of 6 months, while we then start a process to employ permanent workers with all the schools, because it must become a permanent feature at all our schools in post-COVID-19. We have employed 23,000 CWP workers for the Department of Health to assist with the screening, and they were trained by the Department of Health, and the Department of Health will continue to monitor them and apply for more help if and when it's needed. Thank you, Minister.
Thank you, Minister Dilil. Minister Patel.
Thank you, colleague. 3 questions have been put to me. The first one is from Rainbow FM. on what is the purpose of the toolbox that I spoke of. And I think Minister Ngesi has already covered some of this. I want to really just build a bit on what was a fairly detailed reply that is given. When we open the economy for a greater number of workers to return to work, it means more movement of people. And that does mean greater opportunities for the virus to spread. And the danger here is that a poorly executed return to work could lead to a sudden spike which can overwhelm our healthcare system. To avoid that, what we have been saying is we've used one blunt weapon in the past, which is the lockdown. We're replacing it now with a number of sharper instruments in terms of the risk-based approach. And these instruments is what we talk about in the toolbox. So the first thing in the toolbox is that we've issued directions. In other words, in the Government Gazette, we have provided details of what every workplace should do. The distance between workers, the sanitizing arrangements, the clocking in, the canteens, those are provided for there. So that's one critical set of instruments in the directions. But the second thing we've done is we've sat down with industries, a number of industries, employing more than 3 million workers, and they've all taken those directions and see where can they go even further. Where can they reinforce those measures? Where can they deal with challenges that are not fully set out in the directions? I'll give an example that if we have no change in the start of working time at factories and large businesses, we will continue to have enormous strains on the public transport system. So in many of these cases, companies have looked at staggered starting times so that instead of all the pressure being at one moment, we flatten the curve during the day of when transport is needed. And then we've also had business federations issuing guidelines to the members, and trade unions are also working now to see what are safe measures. So out of those initiatives, we'll have a number of tools in the toolbox. The question is, are these tools being used? Because you could have a toolbox filled with tools but not use them. And so to do that, there's a number of measures we've put in place. First, the regulations provide that every workplace must have a COVID compliance officer. One person who is nominated officially, that person has the legal responsibility to ensure that these measures are put in place and is accountable if asked why there has been a lapse. That person has to then respond to that. So we hope that the COVID compliance officers will have everybody's support, because they are an important instrument, an important means of ensuring that the measures are adhered to. Secondly, we've asked businesses to commit that all of their managers will be responsible for safer working places. This must be an all-in effort. Third, and this is where Minister Ngesi and his team has been leading our thinking and our work, it's to use those inspectors that the Department of Employment and Labour has, inspectors that other government departments have, at not only at national level, but even at provincial or local level. And of course, there are innovations. The other day, one of the trade unions have mentioned that we should even get bargaining council agents to be trained to look at compliance. Finally, and very importantly, it's shop stewards. South Africa has tens of thousands of shop stewards in different sectors. And these are workplace representatives chosen by the workers. In the past, shop stewards have looked principally at things like wages, working hours, unfair dismissal. We're asking the union movement, we met with them, we're asking them, shift the focus of shop stewards to saving lives, to ensuring that the COVID measures are introduced, that the toolbox is used at every workplace, and work with the managers, but also report to government if there are breaches that cannot be resolved at the workplace, so that we can come in and make sure that we don't have people's lives being put at risk unnecessarily. The next area that was asked was Cal Cohen from News 24 asked some questions about the National Ventilator Project. So let me just recall, I showed Cal earlier an example, a prototype of one of the ventilators. We launched this project in April. So in February, we saw the rising infections. In March, when the president addressed the nation and said we're going to go into lockdown, we immediately put feelers out to see where could we buy ventilators globally, because we were not making them in South Africa. And we found that the global market was absolutely depleted, that as soon as ventilators are made, are snapped up, and the prices were rising. We then put a call to South African innovators to come forward. And in April, that call was formalized publicly through a request for proposals, saying anyone who's got a viable idea how we can build ventilators here, please do so. And we had a really strong outpouring of support. Some car manufacturers, the people who make the components for cars, put up their hand and said, we can do something. Appliance manufacturers who do the kind of normal appliances used in the kitchen said we can repurpose our technologies. And innovators in some science councils and others all came forward with ideas and suggestions. So we said, let all those ideas come forward. And the purpose of this is to narrow down to 3 final companies. These 3 final companies would then be appointed and they would commence production. So production will now start in June. And the questions we ask with ventilators are they fit for purpose? In other words, do they allow the basic function of getting oxygen into the lungs? We ask the question, are they safe? These are people's health that are being addressed, and so it's important that they meet the safety standards, and that's we have the South African Health Products Regulatory Authority that also looks at these kind of things. Then we look, are they flexible? Can they be used outside of a major, well-equipped hospital? Can they also be used in field hospitals in rural areas where we don't have all the facilities that we need? And then finally, are they affordable? Can we have a bit of competition between players to see can we get a pressure that the prices must not be too high? And so that's been what the effort has been to date. On the numbers, production will start in June. Of course, with these things, one can't predict with absolute precision because they're new technologies, they're new businesses in some cases, where one company that has not done this before is repurposing a whole production line. They've asked us to have some degree of patience and understanding as they ramp up, because normally it takes 3 years to do something like this, to have the design sorted out, take it through a regulatory process, start the production and so on. We're seeking to reduce that to 3 months. And in doing so, July will be a full-on production month if all goes well according to the schedules. And by August, we hope to achieve at least 20,000 units that would have been produced. Of course, if there are glitches and challenges, some of these numbers may be affected. But we have companies that are very confident. They're saying to us they're rearing to go. We've just got to make sure that all the necessary legal loops are crossed, because in the healthcare sector, unlike the making of widgets for a microphone, there are requirements to ensure that people are safe. Amanda then asked the question, well, if they are produced, will we have a special dispensation by Treasury for the procurement or the purchasing of this? We've worked both with Treasury, but we've also worked very actively with the Solidarity Fund. Members of the media, South Africans will recall the President announced the formation of the fund. It's a fund that brings together people from business, from labor, from society at large. It has the backing of government, and it has raised a significant sum of money already from individual contributions and monies firms have put in. Many South Africans have agreed that a portion of their wages go there. Some have made a contribution at supermarkets or crowdfunding. And that money has been used to buy masks and do all sorts of things to support the fight against COVID-19. The Solidarity Fund has already made available a small sum of money. We call it seed funding to get as far as we have. And they're looking at a proposal now together with a consortium of other funders to make a purchase order of the order of 20,000 units. And if we're successful with that, we still continue talking to National Treasury to get additional units purchased. And of course, as more units run off the production line, coming back to the earlier question that was put to us, we hope we can also export some of that. So the first focus now is to make sure that we meet the basic demand of the domestic market and of neighboring countries, and then hopefully build viable and strong businesses that can stay in business even in the long term. Because these CPAP machines that we're talking about are used for a range of respiratory illnesses, not only COVID-19, but obviously the demand for them, the units required, are enormous in this period. Thank you.
Thank you very much, Minister. That concludes the questions that we have had up to now. Do we still have some on the online platform?
Yes, thank you, Minister. We have two callers. The first one is Mercedes Pesent from SABC and Mushengu from Sunday Times. Over to you, Mercedes.
Yes. Good afternoon. Minister Thulas Nxesi, we are inundated with calls or complaints, especially within the retail sector, where some workers say they are told if you self-isolate for that 14 days, you won't get paid. So some of the workers, they then just go back to work, and because they are afraid that they won't get paid. And while they are still awaiting their results, and later some of them, they might return positive. So what must happen? That's the first one. And then you are saying, Minister, that unions must come on board and shop stewards, because you won't be able to do it alone as a department. Now, you know that other workers are not organized, in the workplaces, and they are not being allowed, and they are intimidated. But other workers, they are saying when they want to report some of this non-compliance and when they are forced to work, despite the COVID case in the workplace, they can't get through to register their complaints with inspectors. So that is also the other situation. What must happen in this regard? And a last question, I've heard Minister Patel speaking about the COVID compliance officers. I want to know, how must they be on site, or do they also work virtually? Because I just heard today from one person in an institution that they only know the compliance officer, but they've never seen him or even in the building.
Okay. Next caller.
Good afternoon, Minister. Thank you very much. My first question is to Minister Delil around the quarantine facilities. I think she mentioned 1,751. Of those, 642 are state-sponsored. And then there's 129,600 beds. My question, therefore, is, of the state-sponsored quarantine facilities, how much was spent in total? And of the beds and the quarantine facilities in total, how many are occupied up to this stage and how many are not occupied? Same question on occupation on the beds. And then secondly, on the beds, I think the minister didn't give us the division as to the ones for the state and the ones that are private. And on the private ones, does it mean that the private ones, people who are quarantined there, will have to pay? Secondly, to Minister Mantashe, Minister Mantashe gave us the numbers of the test, 4,600 and positive 384. How many mine workers have been at work under level 4 and how many are expected under level 3 in total? Thank you very much.
Can we hear from you, Nanga?
We have a follow-up from Vuyo Mvoko to Minister Mandashe, and he's asking, with hindsight, did mining not open too soon and too aggressively? And he's also asking that that his previous question to Minister Nxesi was not responded to, with regards to employers who had applied for the UIF in April and were approved but were not given their money. Will they be paid in May? Because some of those employers may have borrowed money to pay employers. Then we have another question from Sidwell from the Mail newspaper. It's also directed to Minister Nxesi. Earlier this month, the Department of Employment and Labour announced new regulations that would allow employees to directly apply to the UIF for special coronavirus benefits, but you didn't say how workers can directly request money from the UIF. Can you please explain how workers can directly claim COVID-19 money from the UIF? Nelly from Netwerk Vriendondag is asking Minister Patel, in the regulations for level 3 that were released yesterday, there is a reference to additional restrictions that may apply in hotspots. I would like to know if liquor sales will be allowed in hotspot areas, and is there any discussions to ban liquor sales in hotspot areas? And a related question to that is, the regulations also refer to the sale of liquor may be subjected to certain directions. When will those directions be released, and could you please elaborate on what those directions will contain? Carol Payton to Minister Nxesi. It seems that particularly in the Western Cape, there have been numerous labor disputes over whether employers have taken all necessary steps for health and safety. Are there agreements in place that can be used as a reference? Nazir from Glow TV is asking Minister Patel, I understand that you are dealing with businesses who are inflating prices, but how are you curbing the inflating of prices by private individuals who may not normally, who are not normally in this business, but are exploiting the situation and are importing containers of COVID-19 related goods? One can only go on social media to see how consumers are being exploited. And then a follow-up from Nazir.
How many have you put to us now? More than 5?
That was the 5th one.
The last one.
Can I just do the last one? It's actually a lobby, and I support this lobby, Minister.
Let's hear your lobby.
He says, I've taken note that you said yesterday that you are busy engaging with hair salon groups concerning reopening. Just to say that given that many learners and teachers may be going back to school on Monday, grooming and neatness is vital. Thus, haircuts are desperately needed. Hopefully, you will reach an amicable solution soon. Thank you.
It's a comment. Who starts? I've started with Mr. Mantashe.
I have 2 questions, Minister. How many workers are at work in alert level 4, and how many are at alert level 3? I can't give exact numbers, but I can say, if you take alert level 3, we extended the workers who return from collieries that supply Eskom and refineries, and the production at reduced capacity for other mines. At level 4, we extended that to say all open casts must be at full production at level 4. I can estimate that to be 2/3 of the workforce in the mining industry. And then the 1/3 will be at level 3 when you ramp up production in deep mining. Mining is employing over 400,000 workers, so it's quite a big number of workers. So exact number, how many were there at that level, we can't give that. Did the mining not open too soon and too aggressively? Actually, one time when we're discussing this thing of opening mining, there was an argument that why should we open mining? We pointed to everybody in government that, listen, if you don't open mining, you are going to be hiding the extent of COVID-19 because there's a concentration of workers in mines, and that is a regulated area. So a regulated space is better to test and screen than people who disappear in villages. You know, one time we had workers coming back to a Portland mine in Tubatse Valley, and in that case we discovered 19 cases in one set of testing. When we did that testing, we discovered that 3 of those workers were from Mozambique. 2 were from the Eastern Cape, 1 was from Zimbabwe. Meaning that the result of the matter is that the concentration is not necessarily in the mines. It's people who are all over the country who are coming together now to the place of work. And the reason that we said there must be screening and testing, we insisted on that, was that we wanted to discover the cases that are positive in the industry. If we don't do that, we're going to have a disaster of just discovering a big amount of workers. You know, Mponeng tested over 600 workers, and 1/3 of those workers tested positive because people escaped the screening and testing and went underground. That's where they come to a situation where there's a concentration of a big number of workers. So 1/3 of those workers tested positive. So in my view, we didn't open too quick, we didn't open too aggressively. We should have opened earlier and allow mines to be tested, because if we don't test them, we'll not discover positive cases. You can only discover positive cases when you test.
Thank you, Minister Mantashe. Minister Nglesi.
Let me start by adding on the previous questions about these notices which are given to the employers. First is that the notices are based on the conditions and level of compliance by the employers. There are instances where we see gross non-compliance. Hence, we go for closure. There are instances where the company is given a notice or a warning to improve a number of things. But in all those instances, companies have a right to appeal. They can appeal to the chief inspector if they feel that they have not been handled fairly. And we have activated the processes within that unit of inspectorate that they deal with all these on a fast-track basis. So they still have a right to raise queries about the processes. And we want to emphasize that they must not run to courts. They must use the dispute resolving mechanisms which we have inside. I thought that I must emphasize that. The second issue is, my apologies, Vuyo. I think I've said we are currently processing the April queries. And as soon as those are resolved, the workers will be paid. Even if we have started with the tranches of May, those monies will be paid because they are legitimate. So it's important that we have that particular understanding. So as we are speaking, the April queries and those applications are being addressed as we speak, and we're talking about the queries, which might not be many. There were queries, for instance, in relation to the foreign workers or workers who are coming from outside South Africa in the mining industry. Last week we were dealing with all those queries. And all it takes is for the employers to give us a confirmation about those workers who might not be having the South African ID. So we are dealing with those issues. We're not going to close if those applications are legitimate. The question from Mercedes Percent about inundated calls in relation to the issues of self-quarantine. When the workers have to do that, they get the threats and intimidation and be told that they can be expelled. I think we must give a notice to the employers who are behaving like that. We will be lodging disputes on behalf of those workers. We will do that against those employers once we get the detailed information. It's becoming very clear to us that the new inspectors who are out to appoint will have to flood the Western Cape because we are faced with a huge problem in the Western Cape. But it's not surprising given the national statistics and the trends in the Western Cape that there are serious problems in that province, even if at some stage it's going to go into the other provinces. But the employers need to understand one thing. It's not just about disputes or challenges. Sometimes we can lay criminal charges against those employers who are forcing the workers to do wrong things. Once the workers have been infected, we can be able to do that, depending on the merits of that particular. So it's criminal what they will be doing to violate the law and expose the workers into such dangers. So they need to understand that. So we can be able to act on behalf of those workers who are unorganized, whilst the unions will be able to work on behalf of their own employees. Sidwell talks about the direct applications. The application have always been done by the employers, and we have been paying the employers. But realizing that some of the employers were resisting, were not applying for the workers, we have now said we're opening for the workers to do it directly. These are some of the queries which we are dealing with. And as we go into the next stage, the employers would still apply, but we will be paying now directly to the workers, as much as the employers have applied, because it leads to a lot of disputes. Some of the workers feel that they've been shortchanged. We've discussed this matter at NEDLEC, and we have agreed that let's pay directly to those workers. But still, the employers must do the applications. But some of the workers we are going to be dealing with. That's why I was talking about with the reopening of our labor centers. We expect huge numbers of the workers who will be coming to come and raise their disputes, their queries. And some of them are even saying, we have seen from what we have published in your website that our company has been paid, but it has not given us money. So these are all the issues which we will be dealing with. I'm not sure if, yeah.
Are you then saying, Minister, the workers can then come to the labor centers to lodge complaints and even applications?
Yes.
The question was, how can they apply?
One of the issues, the reason why we're insisting on these electronic applications is because our labor centers were closed, and only a few opened in the UIF offices who were doing the processing and so on. But now, as we are opening, it's going to give a chance those who do not have the necessary technology to come directly on their own, to deal with the applications, to deal with the queries. But even there, we also have to be very careful and readapt our offices, the social distancing arrangement and so on, because they are going to come. And if you look into our statements, we've been talking about the 1st of June. But what is very clear, there's a lot of work which we'll have to do in readapting that. Hence, we are saying those offices might be full-blown working as from the 8th, but we are starting on the 1st of June. Some of them might be ready before that, but would need a few days to be able to do this particular redesign of our own offices.
Thank you. Minister Patel.
Thank you. Let me start with the question by Mercedes Percent on the COVID compliance officers, whether they need to be on-site or can they be virtual. The regulations don't specifically state where the compliance officers need to be located. But a careful reading of it indicates that from the regulation side, we see a very active role for these compliance officers. They're people in the employ of a company. They're the designated officer, and they need to do a number of things. They must ensure that a plan that has been developed for the workplace is actually implemented, and that there's adherence to the standards of hygiene and health protocols in that workplace. They need to ensure that there is a phased return of workers, that everybody don't arrive on Monday morning at the factory gates and stand outside in large numbers and provide opportunities for infections to spread. In that plan, it must look at which employees are required back at work. What about those ones that need to be available to work off-site? In every workplace plan, the full details, the name and details of the compliance officer must be set out. And the regulations go further, and they say that the designation, the compliance officer must ensure that safety controls are strictly adhered to, and that the name of that compliance officer, in the case of retail, must be displayed in the store itself. So when you come into the supermarket, the name of the compliance officer is there, because that's the person that's accountable. So practically speaking, compliance officers would have to be on site to be able to make this work and to carry out the responsibilities that is placed on them. On the question by Nelly from News 24, and her questions related to the sale of liquor, when will directions be released and what will they cover? I should point out, Nelly, that it's not a requirement in the regulations that there must be directions. It says the sale of liquor may be subject to directions issued by the relevant cabinet member. The government has received the proposals from the industry, how they can deal with managing the reopening of stores and facilities, social distancing, how to address concerns around binge drinking and so on. We are evaluating those, and if it becomes necessary to put a direction in place, of course we will do so. If these are, and a big part of level 3 is about companies, firms, managers taking responsibility, because in level 5 and 4 there were tight, very, very detailed regulations. In level 3, it is a shift of responsibility to the workplace to take care of the protocols and the social distancing that's needed. Nazir of Glow TV raised the question of inflated prices, and he asks the question, can action be taken against private individuals? The national consumer legislation applies not just to firms, but also to any juristic person, basically. So in other words, it would ensure that we are able to investigate and get to the bottom of these matters. I'm just looking for the toll-free number. So natural persons are also covered. So if you import a large quantity of goods and you sell it as an individual, you would still be covered by the consumer legislation. The National Consumer Commission has a toll-free number. It's 08000 14 880. 08000 14 880. And I would encourage Nazir and the listeners to provide that information. Of course, the two regulators are very busy investigating. Each case takes a bit of time to get to the details. They've got to get the information before deciding if there's a case to be answered. And so we would ask that the public bear with us. But as Commissioner Bonakele has said, there is a definite awareness in the market that the regulators will act. And even if they don't act this week or last week, they are collecting information and evidence, and prosecution can follow at any stage. So it's really a call on individuals and the firms to act with enormous restraint. Even government has been inundated with people who have been texting and phoning and saying, we've got personal protective equipment. And when we investigate the prices, they are enormous, very, very high prices, enormous margins that people have put into some of these. Not everybody does it, but there's been a number of cases like that. And then government has declined to pay those absolutely inflated prices. Thank you.
Thank you. Minister Dide?
Thank you, Minister Ntembu. As of yesterday, the updated figures have is that we have activated 66 private sites with just over 9,000 beds. We activated 72 public sites with just over 3,600 beds. The rates in the private sector that were negotiated by National Treasury, it ranged between 850 to 1,200 rand per bed per night. In the public sector, the cost is borne by government and by the provincial department, providing bedding and food and any other assistance. The number of people in quarantine fluctuates on a daily basis because some people leave after 14 days, then other people will come in. But the number of people in quarantine is always provided by the department now. Thank you, Minister.
Thank you very much, Minister Tilil and my colleagues, Minister Mantashe, Minister Maisi, Minister Patel. Do we have questions?
No, Minister, we don't have questions.
Thank you. Now, I know that I don't know why the media likes that WhatsApp number. Nanga, let's take your last five.
Actually, I only have it's the last two, actually.
Oh, that's much better.
Yes. John Fraser is asking Minister Patel to please name the 3 chosen ventilator manufacturers. And there's a question from Alan, again for Minister Mandashe. If there is time and space, could you please give more details on the thinking around companies accessing rehabilitation funds, and what is the thinking around how this will be used when rules around this, when rules around the use of this money are extremely rigorous about withdrawals? What will be the circumstances when this will be allowed, and is there a maximum percentage of funds that can be drawn? And Naziraj just asked the Minister to respond to the question around the negotiations for possible opening of hair salons on Monday? Thank you.
Okay. Maybe I think that question has been asked, the one of hair salons, I don't know who wants to start with that one. It was asked quite some time ago, and I know that we've been ducking and diving. And, okay, but...
It's not I mean, just to be serious, because obviously these are businesses employing people, and one recognizes the hardship those businesses are going through. But the challenge we face in all of this is making sure that South Africans is safe is a joint initiative, really, that government has a role to play, citizens, businesses, all of us. And it's working bit by bit, step by step through the different sectors. We've now spent the period since the level 4 working on those areas that can be opened safely or reasonably safely in level 3. And we're now working with those companies to embed various protocols and social distancing arrangements. There are a smaller number of economic activities that have not opened yet. In the regulations, we've specifically provided that when we have finalized arrangements for the safe opening of those additional businesses, then those can be put into effect. We haven't yet. It still requires some further discussion. It's not something that can just be done overnight, because there are risks. I mean, we've seen now as companies and industries reopen, even the ones where workers don't have to work in physical contact with each other, there has been an increase in infections. And at some stage, this translates to more South Africans dying. And so it's a very serious and a very critical issue that we need to work cautiously and carefully on. And for this reason, we will be reaching out to these sectors. Most of our attention has now been to sectors where people don't have to have this physical contact. But in the cutting and hair and so on, there is no way in which it can be done without the person coming into direct contact with the client or the consumer. So there are additional measures that may be necessary, and these will have to be looked at. Right now, our main focus has been on getting those businesses where there isn't that physical contact to the point where they can open. And I think the focus will thereafter go to these other areas. I thought I should just make this point because sometimes the light-hearted remarks that one has to make is interpreted as if government is not concerned about it. We are obviously quite concerned. If I may just take the opportunity, colleague, on the naming of the ventilator companies. John, I'm not even sure if the companies themselves have been officially informed, so it would be something that we just have to wait for that process. I know we're all eager to hear it, but once we've gone through those processes, and in government, the reason why these processes have to be followed is so that the decisions are sound decisions, that all the checks and balances have been put in place, and that the official announcements can be made. Sometimes it's frustrating. Please understand, bear with us, but we are keen to make the story a very positive story, to take journalists and others to the factories, of course, maintaining social distance when the production starts. Thank you very much.
Mr. Ngase?
On your question, God, I can make the last comment.
Yes, that.
No, I want to appeal to all the employers that only a healthy workforce can boost business. The well-being of the employees should be taken very, very seriously. And I'm appealing, we don't need to go to these disputes of courts if we can be able to put the necessary structures. And again, we will be coming for an update about our offices because they will be ready at the different times. Some might be ready earlier in the week, some late, but up to the 8th. Thank you.
Mr. Mantash?
Rehabilitation funds are ring-fence funds for a specific purpose So it's not free money that is available. But what we have said we should do is that in the effort to reignite the economy, we must use the interest earned by those funds for projects that will ignite economic activity. So every project will be assessed on its merit. I must also expand that, because there have been attempts to take money for social labor plan and want to redirect it to pay wages and do that. We have refused, because social labor plan money is not our money. It is commitment by the companies to develop communities. So that money belongs to communities. Nobody must just grab that money and do anything. People will come to us on the question of the interest earned from rehabilitation funds if a project is to reignite economic activity and absorb some of the workers who are actually going to get retrenched in the process of companies becoming smaller. Let me give you this last comment, Baumtem, that companies must accept that our regional inspectors, in addition to labor and employment inspectors, will visit their mines regularly as they do. Is not intended to trick them. We want to ensure that there is compliance, and companies must comply. And any mine that try to hide COVID-19 cases is actually bordering on treason.
Yeah.
Because when you do that and you take a COVID-19 case, you want to register as a private case, you are a threat to the industry, because we'll discover that and the industry will be facing harsh penalties for that case. So, and lastly, I want to appeal to union activists and shopkeepers to appreciate that they have a big role in ensuring that we save lives and we make the industry stronger. Thank you very much for the opportunity.
Thank you very much, colleagues. By the way, yesterday we had a briefing by the Minister of COGTA on the regulations that will kick in level 3 of the lockdown. After the regulations were publicized and made public, we had the JCPS cluster, Minister Begi, Minister Aaron Zwaledi, Minister Mapisa Ngagula also coming here to say what it is that as the cluster they are going to do under level 3. We now have had the economic cluster speaking to us on what are we going to do to continue our efforts to combat the spread of COVID-19. Tomorrow at 10, same venue, we are having the Minister of Arts, Culture and Sport, Minister Natim Tetwa, speaking to what are we going to do in that sector. At 2 o'clock, again, the reason why Minister Mbalula is not here is because he's also consulting with the industry, the transport industry. At 2 o'clock tomorrow, Minister Mbalula will be here to also indicate how are we going to deal with the movement of people through public transport, your buses, your trains, your taxis, during level 3. Again, the reason not here again is because, like I've said, he's consulting with the industry. Similarly, the issues that Minister Patel has raised on the cutting of hair and the attendance to our hair, the Minister of Tourism is, as we speak now, in consultation with the sector. That's why she will also be speaking on those issues tomorrow evening at 18 hours. We are a consultative government. We whatever else that we do, even on the lockdowns, as you will know, we consulted society, we consulted business. As we started the lockdown, we consulted labor, we consulted community organizations. This is in our DNA. That's what we do. We are consultative in nature. Therefore, having said that, all these measures that we have put in place are an outcome of consultation. Social distancing, washing our hands, including consultation with experts in the health fraternity, people who advise the Minister of Health, including the wearing of masks, all these things, which we have now made part of our health regime, are matters that we have consulted fully with the South African community. We are therefore saying, when we say to our people and the people in our country that it is now in your hands, is because we have done everything we have to do at the level of government. We have put in protocols, we have put in health measures that needs to be adhered to. But indeed, at the end of the day, it is now up to all of us. It's up to all of us. That's why we say in our slogan, stay safe. Protect South Africa. It is up to us now. It is now in our hands to protect not only ourselves, our families, our loved ones, and indeed our communities and people that we work with in our workspaces. So all those who are saying that when we say it is in our hands, we are making a mistake, we don't think so. We think we are correct because it is now expected of all of us to adhere to all these measures that government has put in place. Of course, government can't police 57 million South Africans. It's up to us, it is in our hands to adhere to these measures. We'll want to repeat it once again. It is now in our hands. Government has done everything in its power to bring in protocols, to bring in regulations, to bring in all the things that are needed and the framework of things that are needed for us to remain safe under the COVID environment. But if we don't follow those as individuals, we can't then turn around and say that government has not played its part. Government has played its part. Let me repeat what the president said. It is now in our hands. Thank you, and thank you very much.
All right, that brings an end then to the economic cluster briefing. They brought to you, of course, by SABC News. You're tuned into SA Today with me, Flo Ledwaba, with you until 6 p.m. Of course, that briefing chaired by Minister in the Presidency, Jackson Mthembu, and submissions